Support for this work was provided by the New York State Health Foundation and Care Compass Network.
Thank you for joining us. My name is Jack Salo. In this next video, we hear from the leaders of two rural organizations that at least initially had limited participation in DSRIP. We felt it was important to acknowledge that participation in DSRIP and value-based payment may not be a good fit for every organization, and to hear from organizations that have been cautious in their approach. Jackie Leaf is the Executive Director of Seven Valleys Health Coalition, a rural health network serving Cortland County. As a relatively small organization, they had capacity challenges and difficulty tying community-level programs to patient outcomes in the way DSRIP required. Tamie Reed is Executive Director of Otsego County Office for Aging, which provides essential services to the older residents of Otsego County. While open to new opportunities, Tamie has been careful to not let DSRIP divert Otsego County Office for Aging from their mission and service priorities. You will also hear that they are considering entering into Medicaid billing, which is not necessarily part of the model for most community-based organizations. We're here this morning at La Maison Blanche in Norwich, New York, to talk with Jackie Leaf from Seven Valleys Health Coalition and Tamie McDonald, Director of Otsego County Office for Aging. And we'll be talking about your experience with the DSRIP program and also any plans you may have moving forward with a possible DSRIP 2.0, and also sort of the ultimate outcome we're looking for, which is value-based payment arrangements and contracting. And we invited you here because I think you both have a great story to share, and you also reflect sort of the smaller and rural organizations and governmental service providers that really are critical, in my opinion, to the success of these efforts. But being small and being rural presents some challenges. So let's start out by having you describe your initial reaction to DSRIP and your decisions regarding how much to engage with that opportunity.
We saw it as an opportunity when they talked about being able to increase health outcomes for people and improve that, and especially the unnecessary readmissions. That spoke directly to our population. So we heard COPD and congestive heart failure, and we saw that this was our population that would be involved in this, and so we engaged immediately from the start. It was a sacrifice at the director level to you know, take away from the priorities that were already on our plate and jump into this with a lot of unknowns of whether this was going to be fruitful for us, whether it was going to directly impact our residents and our sector, and so it's a bit of a risk to know whether or not to jump in and how much to jump in, or if this is just another new project that's going to come and go and on to the next. And that's the scary part, is not knowing whether or not the time you invest in something is going to come to fruition and actually be an impact to the people that we serve.
Yeah, I was at the table right from the beginning and trying to help with the needs assessment piece that they did and determining which priority areas that they were going to focus on. So it was a lot of time commitment and not being at all sure if there was going to be return on the investment from our organization's standpoint, but feeling that we needed to be at the table to make sure that they understood what the needs of our community were.
What else were you involved in with the DSRIP process, or was that it?
Other than what we were doing with the needs assessment, then the chronic disease self-management, but really we weren't able to find any good niches for us for quite a while, because primarily we're community-based organizations serving the entire community, and this was really patient-based.
The services we provide directly speak to social determinants of health for us. So we look at the transportation and the housing and the in-home services and the nutrition that we provide on a daily basis. We know that those services keep people out of nursing homes. They keep people in the community and keep costs much lower. So we're able to do it at a much cheaper rate than a nursing home obviously would. So we know that. So it's being able to really articulate that ability. I think being able to show our outcomes, which we're not good at, and I think that's an area we definitely need to learn and grow. But being able to show directly to the healthcare systems that the services we already provide, the infrastructure we already have in place is perfectly aligned to meet some of the outcomes that they're looking at achieving.
You know, so we're talking about data collection. And if you're a small organization, if you've got a tight budget, you know, what do you do about that if you need a software system or hardware for the data collection?
We've started. I just got a new server this last year, and we're starting to make sure that we are aware of what those systems are and getting things in place. And so we're getting ourselves prepared because we're doing very little bit of the patient information collection now, and so we're old school with things locked in a file cabinet, and so we're changing into having everything electronic. So that's just a slow process getting all of our systems in place. So we have the hardware, it's making sure that we have the policies and procedures and everything else.
I think we're set up to move in that direction, and it's going to change what we look like, especially if we move into billing and coding, Medicaid. That's going to be a new level of expertise that isn't currently embedded in our organization. The case management, the community health workers, we have the staff that they know their resources. They're in these clients' homes. They know what the community services are that are available to them in the very rural, isolated areas. So it's really understanding how we bill, how we build the partnerships, and then also the outcomes to really directly show from a patient standpoint. And I think your point regarding getting connected to the medical records, the electronic medical records and EMR systems.
Let's pretend that it's 4 or 5 years out and you're considering participating in one or more value-based payment contracts. How does that change your organization? What does your organization look like at that point?
I think first and foremost, there has to be an understanding and an appreciation for the amount of expertise that is in the community and in community-based organizations. Most of our organizations have been doing what we do for a long time. We're very good at it. We're well connected with our community, and we know what's available and what's going to help. So as the healthcare system, you know, we wouldn't come in and start diagnosing people, and we don't have that expertise. This is our expertise, and this is where we can be a huge support to improving health outcomes.
Just because you're on Medicaid doesn't mean that you should get this access to this, where other low-income people that don't qualify don't get access to it. And the systems changes, it's for the good of everybody. You know, you start from elementary school, you know, birth on up, making healthy choices and, you know, walkable communities and all of those things. It's to the benefit of everybody and keeping everybody well and out of the hospital.
Again, thank you for being with us this morning. I think it was terribly important that particularly our small and rural community organizations, county level service providers, have heard what you shared with us today, because I get concerned that there's an expectation that everyone participate in DSRIP and value-based payment, every community organization everywhere, and that we're all in and end of story. And I don't really think that's true. And I think depending on who you are, what you do as an organization or a service provider, it may or may not be the opportunity that you want to enter into. So thank you for your time. I think it was great being with both of you and listening to your stories, and I think it is an exciting new time, and navigating these waters can be a challenge, and it's conversations like this that certainly, I think, help us understand maybe where we're going and how to get there. So thank you both.
Support for this work was provided by the New York State Health Foundation and Care Compass Network.